Hey everyone, and welcome to the Balanced Bodies Blueprint. I am your host, Vinny Russo.
And I am your co-host, Dr. Erin Stansfield.
And we're shifting gears from all the conventional fitness narrative you hear on most fitness podcasts, as our main emphasis lies in preventative healthcare, adopting a holistic approach to nutrition, and challenging the traditional views on various fitness topics.
Our mission with this podcast is to provide you with the information you need to achieve optimal health.
And on today's podcast, we will be discussing something that's very dear to heart to both myself and Dr. Erin. We are going to be discussing 5 very important questions that are going to be answered for people considering going the IVF route. Now, this is close to home because that is how our baby was born. We went IVF with Eva Bella and couldn't be happier. Could not be happier. What an experience. Just to give a quick update, because I know we've mentioned this stuff in the past. Right now, my bicep is pretty good. It's not healed. I can't do any physical therapy yet, but the extension of the arm is good. Not too much pain, and I'm finding ways to work out, without putting any tension on the bicep. So I'm able to do some shoulders. Found a little way to kind of stimulate my chest, but nothing too great. Nothing with the back yet, nothing with the triceps, obviously nothing with the biceps. So a little bit of upper body work in there. I went back to boxing as well. I'm not throwing any punches with the left. It's actually strapped to my body, but loving the workouts that I'm getting there. So that's a quick update with my injury. Quick update for me and Erin with parenthood. Baby Eva is starting to recognize our faces now a lot more. So there's a lot more smiles going on, which is really cute. It was funny because just the other day I was in a terrible mood and I was changing her, and she just like smiled at me and kept smiling and just totally alleviated all of that anger. I don't even remember what I was mad about. It was just like one of those days, and she fixed it real quick with a quick smile with no teeth. She's all gum, and it was really, really cute, and it definitely got me out of my bad mood.
Yeah, our schedules are still disorganized. She's still waking up randomly, so we're still trying to navigate that as best we can.
And you might hear her cry, you might hear her coo. She is in the background with us right now, actually right in between us in a little, what is that thing? A bouncy
chair.
Yeah, something like that. Anyway, so let's dive into this. So IVF, like I said, is very dear to heart to us. We're very fortunate to be able to have done it. We're very fortunate to be able to have this type of procedure, medicine, whatever you want to call it.
Medical intervention.
Yeah, to be able to do this, because otherwise, with Dr. Erin's age in terms of egg reproduction, and then me with my sperm count, which was on the low side, and some were motile, we really needed help, and without this, we wouldn't be able to have a child. I wouldn't have my first kid. So. Yeah. So we're going to dive in. We're going to talk about important questions. Dr. Erin sort of built this out, and she's like, these are what people need to know. So I'm going to jump right in with the first question, unless you have anything else you want to say about.
No, at the end we'll talk about kind of our personal experience with the whole thing, but we'll get into the details, like for anybody who's kind of looking at IVF or, infertility is quite common actually. And it's defined as trying to have a child for up to a year for some couples. And so IVF is one route for couples who are infertile to have a child, or sometimes not even infertility. It's sometimes you don't have a partner and you want a child, something like that. So anyway, there's various ways that people arrive to IVF. And infertility is one of them.
Yeah, and we don't want to bore you right now with our experience. We want to give you the info first, and then we'll give you our experiences afterwards. So if you don't want to hear our experiences, you could just turn it off after we give you all this information. So this first thing that I want to ask you, Dr. Erin, is what are the success rates with IVF, and how do they vary by age? Because that's something that we had to consider. And we'll touch into the personal experience, but we weren't successful the first row. So why don't you touch on the success rates and then how they vary with age?
So I'm going to talk about the women's success rates because that's been closely looked at. So they vary, like Vinny said, based on age. So again, women under age 35, in pregnancy above age 35 is considered geriatric. I know it's might be offensive to some people, but in medical terms, it is an older age. So women under the age of 35, there's about a 55% success rate with IVF.
It's kind of low, isn't it? For under
35? And you got to consider that a lot of these women were likely infertile, so there might be other various medical reasons why they might be infertile. One might be like PCOS, or that's probably pretty common. And then women 35 to 37, it's about 40%. So then it goes down subsequently after that. Women that are 38 to 40, it's about a 26% success rate. And then women over 40, the success rate drops to around 8%.
So it's like a 15% drop every 2 years almost.
Yeah, and you got to think that one, a lot of this data comes from now women starting to have babies after the age of 35. I think this was less common before, so there is some variability with the population. But in general, those are the success rates you're looking at. They aren't zero. I like to say that for the women over 40, and I was in that category. And so I had a very slim chance of getting pregnant, but slim is not zero. So just for those out there that are thinking about it. Yeah.
So what factors can influence the success of IVF? Because as you just said, I mean, those numbers aren't really playing to anybody's favor.
So factors include, we spoke about the age of the woman, the quality of the eggs and embryos. And I'm going to say that, I'm not an OBGYN, so these questions would be better answered by an OBGYN. But in general, this is what we look at. Quality of the eggs and embryos, underlying fertility issues. So again, like something like PCOS, or whether you have regular cycles, that sort of thing, that's going to influence the success rate. Lifestyle factors, which is important for us because that's something that as a person or a woman or whoever's considering this can modify. So diet, exercise, smoking, alcohol consumption, those things will influence how healthy you are and if you're able to sustain pregnancy, and then the number of IVF cycles attempted as well. So again, I'm not an OBGYN, but these are just general factors that are considered when you're looking at the success rates of IVF.
Yeah, just two things too on lifestyle factors. So we've actually had a few clients that weren't able to get pregnant, and because of weight loss and improving their overall health, they actually were able to get pregnant. And I think that has a lot to do with it.
Yeah, and again, you got to think like with PCOS, if you're insulin resistant, that sort of thing can also have, so insulin resistance in general can have an effect on fertility. Again, weight loss, they even talk about Ozempic babies, for example. When people lost weight, they seem to get pregnant quicker. So it does influence whether you can get pregnant and then sustain a pregnancy.
Yeah, and then the second thing was when you brought up alcohol consumption, I'm going to say that you're a little bit of an outlier. Like, yes, you fell into that 8% category, but you also had you grew up Mormon.
Yeah.
So you didn't touch anything until like your late 30s.
Yeah. So
right?
I was.
Well, hold on, because I wanted to say, like, if you look at like the average person, they're drinking in high school, and then they're partying in college, and then that continues on. They call it the freshman 15 for a reason. There's a lot of alcohol consumption, and I feel like that could play a role in in those percentages, because that is the norm with most. But you, I feel like, are a little bit of an outlier because you refrained from all that, even when you left the Mormon church, which was way before your third, was it?
Yeah.
You were before your 30s, right?
Yeah.
You still refrained from it because it was values instilled in you until, you decided later on in your late 30s to go and, have some alcohol. But I feel like that helped us in particular.
Yeah, and that might, I don't know like how much alcohol consumption actually influences, like percentage wise. I don't know the exact data, but I will say that keep basically having a good lifestyle with diet, exercise, and not consuming alcohol is a toxin. Not consuming a toxin probably does help your chances a bit. So
yeah. Well, now with this too, with IVF, it can be pretty expensive if you have to run through multiple cycles. Yes. So what's the average cost of IVF? And if you want to touch on sort of our experience with IVF and how we got pretty lucky.
Yeah, so IVF is very expensive, and some insurances won't even cover it. So a lot of people are stuck paying out of pocket if they really want to have a child.
I thought they were passing something to where it would be covered.
They talked about it in the when Trump was running for president. I don't
Has
know
it come up yet?
I don't know that all insurance companies are covering it.
Let's keep our fingers crossed with that one because it's a beautiful thing.
Yeah, so we were really lucky in that our insurance coverage did happen to cover it, but it can range anywhere from $12,000 to $17,000. I've seen up into the $20,000 range per cycle. And a lot of people aren't successful on the first round of IVF, and so you got to think that you might have to do multiple cycles. People do take out loans. There are financing companies out there that do help with this. Sometimes the clinics themselves offer some kind of financing, but it can be quite a bit of a financial burden on somebody who really wants to have a child that's that comes from their genetic pool, if you will.
Does it get cheaper with as the cycles go on, or no?
Not necessarily, no, because they, depending on what needs to be done, the medications are expensive, the doctor intervention's expensive, and usually, if a cycle isn't successful, you have to start all over with a new cycle, and so it's a lot of it's very expensive, it's very emotional. And on top of it, it is time consuming. Yeah. So you're looking at months. This isn't a quick fix. Cycles take up 3 to 4 months. And that time, and I'll go into this a little bit later, but you are on hormone therapy, so you got to think about that. Think about
an emotional roller coaster.
Basically, yeah. So it's already emotional because you're trying to get pregnant, and then on top of it, you add, these hormones that you're actually being injected with to stimulate ovulation, etc. And that does play a role in that emotional roller coaster that you can experience.
Yeah, and this kind of leads into question number 4, because they are expensive each cycle. So how many IVF cycles should one actually expect to actually undergo?
So
I said actually a lot there.
Yeah.
Sorry.
So again, everyone's different, but average couples that when they look at like how many until you're successful, it can vary anywhere from 2 to 3 before conception occurs. Some evidence suggests that the success rate increases with more cycles, up to 6 cycles. Obviously, there's a thing as too many cycles, right? You can overstimulate. But typically, on average, 2 to 3 cycles seems to be the average before you are successful.
Yeah. Now, this is a beautiful thing. It'll allow you to have children if you are having difficulty having them. But with every good thing, there's probably going to come some risks. Yeah. So why don't you touch a little bit on what the potential risks, or for lack of a better term, complications that are associated with IVF?
All right, so some of the risks to consider are there is a higher rate of multiple pregnancies, though this has decreased in the recent years. I will say that although it kind of...
What does that mean?
Like twin pregnancies, for example, or twin or triplet. This has decreased because they've usually only implant one embryo. at a time. And that is because twin pregnancies or multiple gestations, so triplets, quadruplets, they're actually very high risk pregnancies for the mother and for the children. And so this is kind of typically not encouraged if you want to if you're doing IVF. I remember when we were doing this, my mom said, "Why don't you just put in 2 embryos at one time to have twins," which, you get 2 for the price of 1, I guess. But 1, that would be a difficult thing. And 2, they are higher risk pregnancies. So that's something to consider. And then there's a slightly higher risk of early pregnancy loss compared to natural conception. So obviously you can miscarry once you have the embryo implanted.
Ectopic, right?
That's a possibility as well. Usually they try the potential for ectopic is usually lower, but it can happen. And then there's a potential, as I said, for ovarian hyperstimulation syndrome, because the more cycles you do, obviously your ovaries are going to be responding to all this hormone therapy, and so that can happen as well. And then, as we touched on, the emotional and physical stress of the treatment process. And I'm just going to touch quickly on, if you are looking at IVF seriously, I encourage people to look at this SART report. So SART stands for the Society of Assisted Reproductive Technology. This actually gives data for each clinic that reports to it. And if you have a good fertility clinic that you go to, they will actually publish their success rates. It's a little bit of a complicated report to look at, and you can ask your clinic about their SART report. But it's a comprehensive data collection and reporting system for all these fertility clinics in the United States. And the purpose is to provide detailed information about success rates, and then the IVF rates at each individual clinic. And the data that they collect is voluntary, but a lot of the good clinics will collect this data to report, how successful they are. They do have patient demographics in there, like the age, basically, range, and then their outcome. And there's a lot of transparency in this data collection. Sometimes they'll even engage in a third-party agency to audit the clinics, to making sure that their data is accurate. The reports include data on success rates for the different age groups, like I said, number of cycles performed, live birth rates, singleton, so 1 baby versus multiple birth rates, cancellation rates. So these are people that maybe started their cycle and then decided to cancel, or maybe they got pregnant on their own, that sort of thing. And then the use of advanced treatments like genetic testing and elective single embryo transfer. There's also really great physicians on social media that put out great content. Like I said, OBGYNs put out some great content. One that I followed was Lucky Seacon. She's a fertility specialist in New York. I found her page immensely helpful and encouraging, because she does put out evidence-based information out there, and talks about patient experiences, but also talks about the data out there for IVF. It's nice when you're going down that journey to kind of have a physician who does give you some of those patient experiences as well as the data.
All right, so we answered those 5 important questions where we talked about, the success rates and how age can affect those. We talked about factors that can influence the success of IVF, the average cost, and then how many cycles one might go through, and then the potential risks. But now, before we dive into the personal experiences that we had with Eva, why don't you just give us like a little rundown of what the procedure is actually like?
Yeah, so this is a little bit of a lengthy explanation, but if for somebody kind of looking at like the big overview, like what does a cycle entail of IVF? So I will say, and I won't go into like how many days because the protocols do vary, but in general, the protocol that I did, for example, you're placed on birth control for an amount of time. I was prior on birth control, and so you are placed on birth control. And then you'll get some testing done, some blood testing. You'll get ultrasounds done checking on the lining of your uterus. And then after those kind of check out and, they make sure your labs are okay, your lining looks good, you've been on birth control for a little while. And again, that'll vary. Then you'll start medications. And these medications are typically injected. They're every day. You're going to do Gonal-F and Menopur usually. Like I said, different protocols might be a little bit different, but in general, these are what are used. You do those for about 10 days. They're both medications used in fertility treatments and assisted reproductive technologies like IVF. Gonal-F basically it contains follicle stimulating hormone, so FSH. It stimulates the ovaries to produce multiple follicles, so you get more than one egg. It helps not only to develop but to mature the eggs in women. In men, it actually does have an effect as well. It can be used to stimulate sperm production if it's given with other hormones, and it can be used in fertility issues in both men and women. And then the other medication, Menopur, contains both FSH and luteinizing hormone, LH. It also stimulates the ovaries to produce multiple follicles and eggs. The LH component may provide additional benefits for some patients compared to the FSH alone. So some key points about both medications are both used to induce ovulation in women who are not ovulating or to stimulate multiple follicle development for IVF. And that's what they used it for me, for example, because I was ovulating. They just needed more follicles. Both are typically administered via subcutaneous. Again, these are daily injections you do. And then the dosage is carefully monitored and adjusted based on that blood work that I was talking about earlier. And then different clinics have different ovarian stimulation protocols. So, depending on what the clinic is used, this is typically what the medication. So, and then both hormones can cause ovarian hyperstimulation syndrome. So that's kind of what they watch for as well. After those 10 days, there is an egg retrieval, which is a minor procedure, usually awake for it. A little bit of pain with it, but nothing too crazy. It's usually done at a surgical center or in the clinic if they have a surgical center there.
They give you meds too, right?
Yeah, they give you medicine to make sure that you're awake, but there are some pain relief medications there. You get a fertilization report the next day. So basically they take out the eggs, and then whoever is submitting the sperm sample, they put the eggs and the sperm together, and then you get a fertilization report to tell you how many eggs were fertilized. And then at day 5, they look to see how many are actual embryos, and then they biopsy typically and freeze them. And then at this point, most clinics usually encourage some kind of genetic testing. The most common ones is PGTA testing, which can take up to 2 weeks. And that's where, a lot of these emotions of waiting to see if any of your embryos are actually viable, to make sure they're not any abnormals. So you're looking for euploid embryos that are genetically normal, that have the best chance of producing a normal embryo and a normal baby without genetic anomalies. So if the embryos are normal, you get a call from the lab at that point after a couple weeks, and then they tell you how many are ready for implantation. They give you a genetic testing report and tell you which ones are genetically normal. And then you start birth control again. In the meantime, again, to prepare that uterine lining. And then once protocols vary, then you get implanted with the embryo, and then you cross your fingers and make sure that when they tell you to take that pregnancy test from the clinic that it is positive, because sometimes the embryo doesn't implant or doesn't implant in the right place. And so there are a bunch of factors left up to chance. So again, it is very miraculous for all this to kind of go well. It takes really great doctors at great fertility clinic, obviously great physicians, great skill from the embryologists, and from the OBGYNs that are helping you out there. And then, of course, yourself and your own underlying biology and lifestyle plays into that too. So once you get pregnant, then you have more injections. And almost through the first trimester, you have to use progesterone oil to prep the uterus and sustain the pregnancy. Because you can imagine that the normal hormones that are produced when you get pregnant, they have to help that part out because the embryo was placed in the uterus. So like I said before, every cycle takes 3 or 4 months. This is just a brief overview. Protocols vary, but in general, you're going to be given 2 medications that are going to be injected daily. And then you're going to go through the egg retrieval process. And then even after that, into the first trimester, you're going to have injections.
Yeah, that was a very thorough breakdown. It was pretty generalized, but like you said, there's going to be some variation between the clinics. So let's go into our personal experience. We won't drag this out too long, but why don't you start first with your experiences, and I'll kind of throw my experience because you're the one who went through it. So I'll throw my 2 cents in there, and then maybe I'll talk a little bit, if we have time, I'll talk a little bit about what I had to go through.
Yeah. So obviously, we tried the natural method of getting pregnant, and that did not work. And given my age and my medical background, I knew that we'd probably need some help if we wanted to have a baby. So we did go to a fertility clinic. I did look at their start rates beforehand, and they had pretty good success rates. And, going through the medication route and the whole thing that I just explained is hugely emotional. So our first round that we did, when we got to the day 5 embryo biopsy, we had a pretty good number of embryos. And then when they were sent off for the genetic testing, they were actually all abnormal. They came back abnormal. So none of them were normal. So basically, at that point, we didn't know if we were going to be able to be successful with IVF or not, because again, as a woman ages, their egg quality goes down, and that's why you see that 8% IVF success rate over the age of 40.
Yeah, and to be honest with you, it is an emotional roller coaster because you're so excited to see those results, to think that or to see if you have viable ones or ones that will be normal.
Yeah.
So there aren't any complications. And when they came back all not normal, it's like, oh shit, like what's wrong with us?
Right.
And it's pretty emotional.
Yeah. And, and they can't implant those embryos because they're all abnormal. You'd likely miscarry them, or you'd have a very severely, embryo that wasn't viable, essentially. So that first cycle, I cried. It was terrible.
Well, what was bad about it was not the fact. I mean, that's probably the worst part. But seeing her have to go through, like I had to inject her every morning, and I know you said subcutaneous, but that was in your ass.
Well, that was a progesterone oil afterwards. Yeah, when I was pregnant.
What was the whole? I mean, everything. It was the whole time.
Yeah.
You go through it, and like when we had to do the second round, I was kind of like, I don't know if I want her to really keep putting herself through that. Like it was, yeah, it's pretty traumatizing that like going through all that effort, mixing all that stuff and putting it in every single day, and then coming back with results that wasn't in your favor. It's pretty disheartening. And I was kind of like, man, are you sure you want to do this again? Like, because it was, I mean, you complained about it a lot. I complained about it.
Yeah.
I don't know why I complained about it, but like the amount of scar tissue you built, because you have to stay. Like we were asking the doctors if we could like move the injection site, and they were saying no. And it's an everyday injection with a 1.5 inch needle going into your upper S, almost near your hip, which is a very sensitive spot too. So doing that, I was just like, oh man, I don't know if I want her to keep going through all this. But she decided, yeah, we're going. Let's do round 2.
Yeah. So I will say that, I was fortunate to have a great clinic I worked with, a great physician that I worked with, who was very honest with me about the lower odds of me actually having a baby at this age, right? And actually, going through this process. And after there was no normal embryos on that first cycle, I had a conversation with this physician, and she, said the odds are still low. And I said, I want to exhaust my possibilities of trying to use my own eggs. So you can opt for an egg donor, so you can use somebody else's eggs. We did not want to go that route. We thought if we couldn't do this with our genetics, that it wasn't meant to be. And so I did want to exhaust, as many cycles as I could to see if we could have a child on our, through this process. And so thank goodness on the second round of IVF, going through the whole thing again, we did have healthy embryos, and they were all euploid. We had 1 girl and 2 boys.
Well, there was 5, right? And then
I
only
think
3 made it, right?
Yeah.
3 made it to grow.
Yeah. So at when they called me right after they did the egg retrieval, there was actually, I think there was 5. And then 3.
Then 1 wasn't growing, so then they were like, it's 4.
Yep.
And then like then it was like, all right, we got 3 that can actually do the implanted.
So 3 did the actually 4 went through the PGTA testing. 3 were euploid, which means normal. They had the normal amount of chromosomes. So we had 2 boys and 1 girl. And
it's cool because they grade them as well. Like they grade them on like their size and their ability to grow and how fast they were growing. And 1 boy was AA, which is like the best you could get. Then the other boy was it B?
I think it was BB.
Yeah, it was BB. And then baby Eva was AB.
Yeah.
And we had, so it was a decision we had to make, like, what do we want to do?
Yeah.
And I've always wanted Daddy's Little Princess, and she has a son with her ex, so she always wanted a baby girl.
Yeah.
So it just made sense. So we decided to go with the little baby girl.
Yeah. And when he's talking about the grading, they look at the inside and the outside of the embryo, and that's how they grade. The embryologist usually looks at that and tells you how good. A's and B's are good. Usually when you get into C's, it's not that great, but A's and B's are good grades.
Yeah. It's funny too, because like when we first saw that and we saw the boy having an AA, we both kind of looked at each other like, maybe a professional athlete. So
but yeah, so we got really excited when we did have the 3 normal embryos. And I was, again, that's no guarantee that the pregnancy is gonna happen. But we did have 3 normal embryos, then they have to implant the embryo. And again, there's lots of points of failure there. I was lucky enough that on that, when they put in the embryo, she did decide to implant, and she decided to grow. And then obviously, through the pregnancy, you're a little bit nervous because, I still had to do the hormone therapy, and that's what he's talking about, the progesterone oil that was very painful to put in through that first trimester. And you're always nervous during the whole process. Even when I got into my second trimester, you want to make sure that the baby is healthy and makes it, and so you kind of do everything in your power. Take your prenatal vitamins, stay active, and stay mindful through the pregnancy. But we were very excited when she did take, and then the pregnancy was very healthy. My blood pressure stayed normal. All my labs were very, very normal. I had no complications besides, feeling uncomfortable, and I feel like that's pretty normal during pregnancy, especially that last trimester. But very, very healthy pregnancy. Thank goodness.
Yeah. And just for the guys out there, so like just to give some experience of what I went through, besides dealing with your wife going through emotional roller coasters and maybe getting really upset with you or crying just randomly or maybe just being in a bad mood or maybe being really happy, besides going through all that. So part of the reason why we had to go IVF wasn't just because of Erin's age, it was because I had a low sperm count. And during this time, I was using testosterone, so I was on TRT, and even my blood work, like when they took it, I was low normal on testosterone. So it was a therapeutic dose. It might have been a little bit too little, but I had to come off of that. And you feel it when you do come off. Your mood changes. Over time, your mood changes. You don't really feel like yourself that much. And I'm pretty sure that's because my testosterone levels had to drop. And then also I had to go on Clomid. So I forgot the dosage. I don't know if it was 20 or 40. But I had to go on Clomid to try to stimulate some more sperm production. And then luckily, I was good to go. So
it's kind of a little bit of an indicator, I guess, for you guys all on TRT.
And listen. When we say TRT, I mean legitimate TRT. Okay, I'm not talking about like guys who are abusing gear and then just say that they're on TRT because it sounds better. If the blood work came back with a low normal and I'm using testosterone, that literally is a therapeutic dose. So this is what Dr. Aaron's about to say is for those people, not the people that are using 400 milligrams per week. Okay.
Well, so testosterone can, when you're injecting it, can suppress sperm levels. And so, they used to say testosterone was kind of a form of male birth control. That's not really accurate, but it can suppress your sperm count. And so that's kind of, when you go into a fertility clinic, they're obviously going to do the workup on the female, but they'll also do a workup on the male, looking at sperm count and sperm motility and morphology to make sure, under the microscope that the sperm actually can fertilize an egg. And so that's where Vinny was saying that, his sperm count and his motility was actually both were affected. And so he's young enough that, given that he was on testosterone, they recommended him coming off the testosterone. And it did actually...
It helped. It helped with sperm production.
Yeah,
so it went up and the motility went up. Yeah. Yep. So when we got tested again, I mean, that also with the Clomid, right? Yeah. So taking those measures, it helped. It improved. It wasn't like a young kid in college, but it was enough to be able to have 3 viable embryos that were able to be implanted. So very, very happy about that. But just another message to all the guys out there: be extremely supportive during that time. It's going to be a stress on both of you, and just know that you're not going through what she's going through, right? So, I mean, all those injections, I guess maybe that's the empath in me to be able to feel that and not like actually want her to keep going through that. But just being there, being supportive, understanding that emotions are going to be going a little high and low just because of the hormones being injected into them. And then obviously going through the pregnancy. I'm pretty sure you all heard the stories about women having a roller coaster of emotions. And the main thing is be a team player, be supportive. And if she wants you to go get fucking McDonald's in the middle of the night, you better go. So, but yeah, so that was a little bit of my experience. And Dr. Aaron gave you her full experience. So hopefully this sheds some light on the area of IVF. Hopefully we answered all your questions about IVF. If you have more questions about IVF, Dr. Erin is very, very open about talking to it. She talks about it with some of our clients. So feel free to reach out to her on her Instagram or even me on my Instagram, and I could always link you guys up. So is there anything else that you want to leave our audience with?
No, I'm just that my gratitude for medical science and for physicians that study hard in their fields, because our baby literally could not happen if all the doctors that helped us and the nurses that helped us to get where we are at. And there were years and years of research that culminated into their knowledge, obviously, of this miracle that we get to experience every day now.
Yeah, I couldn't be happier, I'll tell you that. And she is fucking cute. She is a cute little baby. She's got more of I'd say Erin's face in her than she has mine, so that's why she's cute. But yeah, we will see you all on our next episode. I won't say next week because things have been kind of haywire here, so we're not really having a good schedule with releasing episodes. So we will touch base with you guys on our next episode. So on behalf of Balanced Bodies, we just want to say thank you for joining us on this episode of the Balanced Bodies Blueprint.
We are committed to bringing valuable content, and if you enjoyed today's episode, we'd greatly appreciate it if you can take a moment and like it and leave a 5-star review.
On Apple, just go to the show, scroll down to the bottom and rate it there. If you're on Spotify, go to the show's page, click the 3 dots, and you can rate it there as well.
And if you believe in the power of knowledge, share this episode on your social media to try and get the information out there to as many people as possible.
And as you navigate your own path towards better health, remember that Balanced Bodies is forever in your corner. See you all next week.
The podcast content may include discussions of medical topics and health-related information. However, the information provided should not be considered exhaustive or complete, and it should not be relied upon as a substitute for professional medical advice or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition or treatment.